Hello, my name is Dr. Rebecca Wagstaff. I'm the Interim Director of Public Health at Cumbria County Council, and I want to talk a bit today about colds and coughs and flu because we are coming into colder weather and the winter months when those illnesses are a lot more common. Most of us hopefully will get through winter with just a few coughs and colds, but for some there will be flu, which is really quite a nasty illness and will certainly keep you in bed for a week. It's far worse than getting a cough or cold. And although for most people it will just be being in bed for a week, for some people it can be a lot more serious. It can result in hospital admissions, and every year thousands of people in England do die from flu. Coughs and colds and flu are all caused by different viruses, but they're all spread in the same way. When you cough or sneeze, a whole load of droplets come out into the air containing the virus. Other people breathe them in, or they pick them up where they've landed on door handles and on desks. So that's the way the infection spreads. We have a national vaccination programme that targets flu vaccination on all those people who are most likely to suffer the most serious infection. So for us that is people over 65, anyone with a long-term condition like heart disease, like diabetes, pregnant mums, and for the first time this year, younger children. So I want to have a special mention really for the new programme for young children. This year all children aged 2 and 3 are being included in the vaccination programme, and they're getting a different version of the vaccine. It's a version that you just sniff up rather than having a needle, which is much nicer for small children. It's not painful, in fact they say it's a bit like sniffing up bubbles when you have a fizzy drink. But what it does do is protect them from flu, because we know that children's immune system is not fully developed, so they're more likely to get infection. But also, they're not the greatest blower of noses or washing their hands, so they do spread infection both to their parents and to their grandparents and other adults around them. So by protecting them, we'll be protecting whole families. This year also, for the first time, primary school children from 5 to 11 will also be eligible to have this nasal flu vaccine. So please do take advantage of that as well. And a last note really for pregnant mums who are vulnerable to infection, because their immune system is affected by the pregnancy, so they're more likely to become poorly. But by having the flu jab, you'll also protect your unborn baby, and in fact your baby when it's first born, because newborn babies don't have a fully developed immune system either. So it's very important for pregnant mums to be protected now. And then for all those other people who actually aren't in one of those high-risk groups for flu vaccine, what I'd say is remember the slogan, catch it, bin it, kill it. If you've got a cough or a cold, or even if you've got flu, try and catch any coughs and sneezes in a hanky. That stops the droplets, because remember it's the droplets coming out that contain the virus and spread the infection on. So catch it in a hanky, bin the hanky, so don't leave damp hankies, they're full of virus, don't leave them hanging around or in pockets and on desks. Put it in the bin and then wash your hands, kill the virus, because the virus will be on your hands and spreads very quickly. And that way hopefully you'll keep well this winter.